As a nurse, this case has been haunting me because it raises a question none of us want to ask. How can a child be seen by doctors, nurses, health visitors, and social workers, have concerns raised, and still die? 13 months old, that's how old Preston Davey was when he died. 3 times he was brought into hospital before that happened. 3 times he was seen by people like me, nurses, doctors, health visitors, social workers, a whole team of trained professionals. Every one of us required year after year to complete the Safeguarding Children training. Every year, we learn the signs, we learn when to escalate, we learn that if something doesn't feel right, we must act. And yet somehow, he still died. There's one detail in this case that I can't stop thinking about. A nurse and a pediatric sister did notice bruising on his head. They didn't ignore it. They did exactly what we're taught to do. They raised the concern. Safeguarding was raised. Social services were contacted, police were informed, the concern was there, but somewhere after that, everything stopped. A medical explanation was offered and the threat wasn't pulled any further. And as a nurse, that's the part that stays with me. Not because nobody cared. People did care, people noticed, people spoke up. So what happened between noticing and protecting? Was there a communication breakdown? Was it just an assumption? Was that everyone thought that somebody else would take it further? Or is it that something many of us in healthcare quietly worry every single shift? Because if you've been a nurse long enough, you will know exactly what I mean. You're looking after 6, 7, sometimes even more patients. The phone is ringing. Family needs updates. Medications are overdue. Admission keeps arriving. Documentation keeps growing. You're trying to prioritize everything at once, and when you're working under that kind of pressure, every handover becomes critical. Every conversation matters. Every escalation depends on the next person picking it up. The frightening thing isn't that we don't know what bruising could mean. We do. The frightening thing is wondering whether workload, time pressure, cognitive overload, or assumptions can slowly chip away at the urgency something deserves. I'm not saying that's what exactly happened here. None of us can say that unless the investigation tells us, but I do think it's the question worth asking, because every nurse I know has gone home after a shift and thought, did I miss something today? Should I have pushed it a little bit harder? Should I have asked one more question? And that's not weakness, that's the weight of being the responsible for another human being. Preston did not deserve this. He was only 13 months old. He should have been learning to walk, learning new words, making memories with his family, not becoming the center of the safeguarding review. We keep doing the mandatory training, we keep ticking the boxes, but if children continue to die after multiple contacts with professionals, maybe the question isn't only whether an individual failed. Maybe we need to ask the question whether the system is asking exhausted human beings to perform flawlessly every hour of every shift, every single day. Because safeguarding isn't just about recognizing the signs, is it? It's about making sure the concerns never lose momentum once they are raised. And as a nurse, this is the question I can't stop asking myself. How many concerns are raised every day only to quietly disappear somewhere between one handover and the next? Because if you don't have an honest conversation about that, Preston won't be the last child whose name we learn this way.